consideration to be placed on and referred to the appropriate committee.
The resolution will be received and appropriately referred.
Mr. President, the resolution that I, on behalf of myself, Senator Lieberman, and others, is exactly the same as has been introduced by Congressman Berman and Pence in the House of Representatives. It's the exact same resolution, expresses support for all Iranian citizens who embrace the values of freedom, human rights, civil liberties, and rule of law, and for other purposes. The resolution expresses its support for all Iranian citizens who embrace the values of freedom, human rights, liberties, civil liberties, and the rule of law. It condemns the ongoing violence against demonstrators by the government of Iran and pro-government militias, as well as the ongoing government suppression of independent electronic communication through interference with the internet and cell phones, and affirms the universality of individual rights and the importance of democratic and fair elections. Basically, Mr. President, what this is a resolution that has been introduced in both houses, which affirms America's fundamental respect and commitment to human rights to people, no matter where they reside in the world. It's unfortunate in a way that this resolution is required, since the administration does not want to, quote, meddle, and the president has refused to speak out in support of these brave Iranian citizens, most of them young, who are risking their very lives to protest what was clearly an unfair and corrupt election. Mr. President, what we're seeing in Iran today is sort of a sequence of events that should worry all of us who have watched this before. The demonstrations, some beaten, some killed. The Ayatollah Khamenei calls together the participants in the election and then says there should be no more demonstrations and strong action will be taken. That, coupled with ejecting the world's media from Iran, first restricting it and then forcing them out so as not to record events. Unfortunately for the Iranian mullahs, Twitter has become an incredible means of communications, as well as cameras held in cell phones. And the word is still coming out as to the degree of oppression that is being practiced by the Iranian government. You know, Mr. President, there's a lot I'd like to say today about what's going on in Iran, and the fact that we have a long history in the United States of America of speaking out on behalf of people who are oppressed or victims of a corrupt election. We stood tall, America did, for the workers in Gdansk, in solidarity under Lech Walesa. We stood tall for the people of Prague during the Prague Spring, and we were not afraid, as Ronald Reagan was not, to go to the Berlin Wall and say, take down this wall, and call an evil empire what it was, an evil empire. And one of the ironies of this situation that I'd like to address very briefly is that President Mahmoud Ahmadinejad's top political advisor said Thursday that the United States will regret its interference in Iran's disputed election. In other words, our president says that he doesn't want to, quote, meddle, and at the same time, of course, they're accusing us of doing exactly that. He said, the advisor said, I hope in the case of the elections they realize their interference is a mistake and that they don't repeat this mistake. They'll certainly regret this. They'll have problems reestablishing relations with Iran. Mr. President, the history of this country, July 4, 1776, we affirmed a fundamental right that all people throughout the world have, and that is the inalienable rights granted by our Creator to life, liberty, and the pursuit of happiness. That commitment to human rights was there then, and it is there today. And the United States of America must, and this body must, affirm our support for the fundamental human rights of the Iranian people who are being beaten and killed in the streets of Tehran and other cities around Iran. We are with them. It's not an accident, Mr. President, that the signs, "Where is my vote?" are in English. They're waiting for an expression of support from the government and the people of the United States of America. I think this resolution is an important way to do so. Now, Mr. President, I would like to say a few words about health care. And obviously, we are according to most media reports and my experience as a member of the Health Committee, at basically a gridlock. The Congressional Budget Office stated on Monday in relation to the legislation being considered in the Health Committee that once the proposal, and I quote, was fully implemented, the number of people who had coverage through an employer would decline by about 15 million. The Lewin Group, a healthcare consulting firm, estimates this number to be much higher. They estimate that up to 70% of all Americans who have private insurance today, 120 million Americans, will lose their health insurance and be forced onto the government payrolls. That stands in stark contrast to the President's repeated assertions that if you like your health care, you can keep it. And further yet, analysis by HSI Network, a healthcare economics firm, found to get all Americans covered under the Democrats' bill, it would cost a staggering $4 trillion and result in 79 million Americans who currently have private insurance having to obtain coverage from the government plan. What I've just described is known as the, quote, crowd-out phenomenon. It's a substitution effect that occurs when a massive government insurance plan crowds out private insurance as the expansions of publicly subsidized programs encourage or force people from private arrangements to public ones. This is a real issue and one we must pay attention to. On Monday, the President said, quote, "I know that there are millions of Americans who are content with their health care coverage, and that means that no matter how we reform health care, we will keep this promise. If you like your doctor, you'll be able to keep your doctor, period. If you like your health care plan, you'll be able to keep your health care plan, period. No one will take it away no matter what. If the bill that we are considering is enacted, I don't believe this is a promise the President will be able to keep." The President's hometown newspaper, the Chicago Tribune, stated in an editorial on Tuesday, and I quote, "The President promises that anyone who wants to keep their private coverage will be able to do so, but we do know a few things about government run health plans. The federal government isn't competition. It is the health care equivalent of Bigfoot. It sets low prices, to be sure, lower than many insurers are able to match. But that just means those doctors and hospitals recoup the losses by shifting costs onto those with private insurance, which could easily crowd out private plans. A lot of Americans think the health care system isn't really all that broken. They get good care. They pay for it via insurance. But a government-run health plan, experience says that the cure would be worse than the illness." The Chicago Tribune has it exactly right, Mr. President. The fact is, a lot of Americans are pleased with their health care options. In fact, 70% of Americans with health insurance rated their coverage good or excellent, according to Rasmussen Report poll data dated May 14, 2009. Those 70% might be the precise group of Americans who will lose their health insurance and be forced into government-run programs if the legislation is enacted.